Hi there, I am pharmacist Scott Popick, and I'm going to demonstrate how to use your sinus irrigation system. So the process requires the use of a sinus irrigation bottle, and this bottle is going to be filled halfway with distilled water, or if you don't have distilled water, you can use a boiled tap water. And by boiled, I mean bring the water to a boil and let it boil for 1 minute. Allow the water to cool down, and then you can fill the bottle halfway with that. I would say most patients opt for distilled water. So your doctor may prescribe a number of different medications. I'm going to introduce all the different options. And again, your order may or may not utilize all these different meds because the doctor's going to have ordered a regimen specific for you. I'm just demonstrating for this purpose all the different options. So the cap should be removed from the irrigation bottle and the bottle filled halfway with distilled water or that boiled tap water. The next thing that would go into this potentially is sodium chloride powder. So this packet would be opened up and dumped into the bottle. These packets usually accompany the bottle when you purchase a bottle. And there are different brands out there, by the way, that can be used, but they all accomplish the same purpose. So we add the sodium chloride powder. Next, your doctor may have ordered a medication that comes in an ampule. The ampule lid would be twisted off and the contents of the ampule poured into the bottle. Next, your physician may have prescribed a medication which comes in a capsule form. The capsule would be the ends gently pulled apart and the contents poured into the bottle. Next, your doctor may have prescribed a vial, and the vial rubber septum top should be taken off and the powder contents poured into the irrigation bottle. Now, if your vial has caked product inside it, you can take this stir stick and put inside the vial, break up those chunks that are caked and pour it into the irrigation bottle. Lastly, your physician may have prescribed something that comes in a tube. This can either be a cream or a special type of ointment which will disperse in water. Either way, you can open the tube. If there's a metal seal at the top, there's a point at the top of the cap that can be inserted into the neck of the tube to gain access, and then you would squeeze the contents of the tube and empty that into this irrigation bottle. Next, we're going to top off this container with distilled water or the boiled water. So we're going to bring the volume up to this dotted line here. And once we do that, we're going to return the cap to the bottle. And now we have to shake it. And we're going to do that to dissolve and break up all the medications and get them evenly mixed. We want to cover the hole that's in the top of this cap with our thumb and shake this vigorously. And the process is going to take about 30 to 60 seconds. If you have something that came in a tube, probably more about 60 seconds. If you don't have something that came in a tube, maybe even as quick as 15 seconds. But either way, we're looking to see a solution that's looks evenly distributed and everything's homogeneous, so evenly appearing. Anyway, when it's time to administer the medication, you want to get yourself positioned over a sink. Some people also do this in a bathtub, or others in a shower. In either case, what should happen is you lean forward, and we're going to place the bottle tip opening up against one nasal passage, and then we would squeeze. And as we squeeze, the medication, about half the volume of the bottle will actually be discharged into the nose and then up into the sinus space. And then that medication will then fall out the other side of the nose. We're going to, if your physician has ordered this, and most likely they have, you would repeat the process on the opposite side. And that's going to, again, wash through, and then the solution will discharge out. Again, being careful to place the bottle firmly up against the tip of the nose so that the medication goes into the nose and sinus and not out around the bottle. The process is, the first time you do it, maybe a little bit of a shock, something similar to the feeling you get when you jump in a pool and you get water in your nose. But it really is something you get accustomed to, and it'll deliver the medications that your physician wants. Afterwards, you can pat dry your face with a towel if that's necessary. Your nose will probably be running a little bit. Again, you can use a towel to wipe that, or perhaps a tissue. We're not looking to blow your nose or anything like that at this point. We're looking to let any discharge to occur naturally. The medication, we want the medication to have contact with the tissues so that it can provide the therapeutic effect your physician is looking for. So that is the sinus irrigation process. If you have any questions, contact us here at the pharmacy. We'll be happy to help you.